This is Happy. We were contacted by friends of Rowlett Animal Services because Happy had been in Rowlett's municipal shelter for almost a month. She has a visible disability and was not able to make it out of the shelter without some help. We agreed to bring her to Animal Hope and see what we could do to help her. We were able to make an appointment with Dr. Antonio Bowens at Rehab to give Happy a neurological exam and see if there was anything that could be done for her medically.
So any vomiting, diarrhea, anything like that going on?
Mm-mm.
Hey, Happy. How you doing?
Here she comes.
Oh,
Here she
girl.
comes.
How you doing?
So I'm guessing she's always like this.
Yeah, she's always like that. Yes, indeed.
All right, let's get Happy out. Let's take a look at her.
All right. You're better. Obviously, she's been over there for a while.
Hold on. All right, sit. There you go. Good girl. So see, she has nystagmus.
Yeah.
See how her eyes floating around?
Mm-hmm.
See that?
Mm-hmm.
Okay, that's abnormal. So you're looking for a home for her?
Yeah, eventually. You know, we focus a lot on medical cases.
Hey, Debbie, can you ask the staff, the entire staff, well, other than Rachel, ask everybody else to come to room 4. Come on, let me see this. This is a patient that has cerebellar disease. See how she has problems with fine motor movement?
Mm-hmm.
That goes with the cerebellum. Basically, here's my disclaimer, I'm not an artist. So if this is Happy's brain, the brain is divided into 2 main portions. You have your forebrain, which is the front part of the brain, and then your hindbrain, where you have pretty much your brain stem, your vestibular system sits in here, and then your cerebellum.
Okay.
Looking at the skull, the cerebellum pretty much sits back in this portion of the brain. You have kind of like a vault, and the brain sits in this vault. So pretty much here's the bulla of the ear sitting back here. So the cerebellum is the portion of the brain that sits right here before it leads to the brain stem and out towards the cervical spinal cord. Okay, so they kind of put things in. We would have to consider that her history, neurologic exam finding she's hypermetric, has ataxia and tremors. Hypermetria, which you see kind of the exaggerated gait, that's what we're seeing with Happy, both in her thoracic limbs and also in her pelvic limbs. And the ataxia, that refers to the balance issues and incoordination. That's ataxia. She has generalized ataxia, that's why she stumbles and falls over. And then the tremors, so she has intention tremors. Menace response, and basically OU means in both eyes. Usually the menace response is a learned behavior, and it involves cranial nerves number 2 and number 7. 2, basically they see the hand. 7 is the blinking aspect, the efferent or motor function. Patients that have cerebellar disorders or a condition affecting the cerebellum, this efferent fiber that leads to the cerebellum is affected. So that's why they have either, and I usually say they either have a decreased and or an absent, well, it's not and. It's either decreased, or when you read the neurology textbooks, they have an absent menace. So usually patients. So when we look at causes for cerebellar disease in a dog her age, and this is not in any particular order, but obviously since she's only 10 months of age, we have to consider some type of congenital problem or malformation. Has she been exposed to some type of infectious or inflammatory process? Our top one out of this infectious category would be canine distemper for sure. Cerebellar disorder, anything's possible. So depending upon what the test results show would dictate what type of medication we would put her on, or trial period of medication, to see if we can somewhat attenuate her clinical signs and symptoms. But I think all in all, she's happy, not just literally, but figuratively. And, basically, I don't think what's going on with her at this point, regardless of what the diagnosis is, I don't really have a gut feeling that it's going to affect her overall quality of life. I think whoever ends up adopting her, I think she's going to be able to live a healthy, productive quality of life, where both, she's going to, take great pleasure in engaging with her new owners and vice versa.
Dr. Bowens started Happy on some medication, including an anticonvulsant and a muscle relaxer. We've sent Happy to puppy school at Tabitha's house, hopefully to learn some potty training skills and some other puppy etiquette.